you ever gone back and looked at your hospital records for your initial hospitalization and those readmissions?
Oh yeah.
What's the diagnosis?
Which one? Because I went to the original diagnosis, the severe traumatic brain injury. Outcome, they said, I'm going to have a pretty good recovery because, all the things that I shouldn't have done, I did pretty quickly. I'm probably not going to walk again. That was a concern. If I walked pretty good, might have problems with talking, and never lost any of that ability. My ability was the psychosocial stuff that, especially with what I did.
You said, did they do an MRI? Is that where they got the diffuse axonal injury issue?
Correct.
Do you know what your MRI said?
I don't remember that. I remember the pictures of the torn. They could actually see the tears on the one side. It was so severe, and and as you know, they don't show up very well, unless it's pretty torn. And there's a little minor bleeding, and they were a little concerned about the blood. That they might have to go in there and do something about it. But it seemed to dissipate pretty quick.
You never slipped into a deep coma, so they held back on interventions.
Correct.
Were they giving you steroids to keep the swelling down?
Correct. And antibiotics, for infection.
Now, you went home and had to go back. Do you know why you had to go back?
Because the shakes, I couldn't stop shaking. And they were in a, typically you think a seizure is somebody on the ground, but mine were just like, little shakes, but 10 minutes long. And I just remember being drained. And then I wasn't sleeping.
Was it a Parkinsonian type of a syndrome?
Yeah, kind of. Yeah, but of course, when I go in there, I wouldn't be shaken.
So it was episodic.
Correct.
Did they put you on any seizure medicines?
They took a few different medicines before one actually worked. One almost killed me. The inside of my throat broke out, and the lining of my stomach.
So what was the medicine that helped?
A Kipra, believe it or not.
Can you spell that?
I think it's K-I-P-R-A, Kipra.
Kipra?
Yeah, it's an old class seizure medication, and it was actually fairly good because it had a sedative effect. So I take it at night, and so it would help me sleep. And of course, this is long after. I'm actually taking a lot of sleeping pills at this point to get 3 hours of sleep. It took about 2 years to get my first good night's sleep.
Did they do a sleep study on you at any point?
No, they wanted to, but at that point, I was so done with doctors. The psych ward was the last time I reached out for a doctor.
When did you go into the psych ward? Was that the second hospitalization?
That was
that was when you had the suicidal issue.
Right, and I went in there to just what's going on, and that was the last time. I would go in for the headaches. The headaches hurt so bad the first couple of years, and I just would go in with the pain, and the more pain I had, the shakes, they called them shakes, and the seizures would get increasingly bad.